And this is an interesting area about advanced technologies. So there are many different advanced technologies that we're using at the moment in gynecology, in obstetrics, and also in prenatal care. So how should we address them? So there are many different ethical issues that arise from that. Is it permissible for you to know the sex of the fetus, the sex of the unborn child before their birth? Is that a permissible thing to do? Considering that we live in a society where there are certain cultures or there are certain ethical concerns that we have, where there's a greater level of favoritism given to male babies or male children relative to females, and hence in those kind of societies there may be issues in terms of abortions occurring more so when families realize that they are to have a female child. So does that allow us to permit this this diagnostic in terms of the sex of the fetus? So they're important issues. So this is about imaging, and this is about many other areas in terms of reproductive technologies. So very recently we talked about synthetic embryos being produced. Okay, so this is about formulating the primordial sort of a medium whereby we grow embryos, and embryos with their own chromosomal makeup. And we're using reproductive technologies such as in vitro fertilization. So where we are able to get the male sperm, and we are able to get the female egg, and we fertilize it external to the womb, external to the in a test tube or in an artificial environment, whereby once we've fertilized and we've had a certain level of growth there, then we inseminate this back into the womb. So those kind of processes, is that permissible? To what degree is that permissible? Now we've gone to a very different level of, in fact, genetically engineering the chromosomal makeup, the DNA, to avoid certain illnesses or genetic illnesses. How does that relate to this? So some of these technologies in terms of CRISP technology and various other technologies are important discussions. So we'll be discussing some of that in terms of the advanced technologies in gynecology, obstetrics, and prenatal care.